afternoon. My TED Talk is about mental health, but I'm going to talk about specifically borderline personality disorder. First, I'm going to start with an overview. Borderline personality disorder is a serious mental illness that centers on the inability to manage emotions effectively. The disorder occurs in the context of relationships. Sometimes all relationships are affected, sometimes only one. It usually begins during adolescence or early adulthood. While some people with BPD are high functioning in certain settings, their private lives may be in turmoil. Most people who have BPD suffer from problems regulating their emotions and thoughts, impulsive and sometimes reckless behavior, and unstable relationships. Other disorders such as depression, anxiety disorders, eating disorders, substance abuse, and other personality disorders can often exist along with BPD. The diagnosis of BPD is frequently missed, and the misdiagnosis has been no.
No importa, se
No,
supone que
ya,
lo estás.
ya. Other disorders such as depression, anxiety disorders, eating disorders, substance abuse, and other personality disorders can often exist along with BPD. The diagnosis of BPD is frequently missed, and a misdiagnosis of BPD has been shown to delay and/or prevent recovery. Bipolar disorder is one example of a misdiagnosis, as it also includes mood instability. There are important differences between these conditions, but both involve unstable moods. For the person with bipolar disorder, the mood changes exist for weeks or even months. The mood changes in BPD are much shorter and can even occur within the day. Officially recognized in 1980 by the psychiatric community, BPD is more than 2 decades behind in research, treatment options, and family psychoeducation compared to other major psychiatric disorders. BPD has historically met with widespread misunderstanding and blatant stigma. However, evidence-based treatments have emerged over the past 2 decades, bringing hope to those diagnosed with the disorder and their loved ones. Now I'm going to talk about the incidence. BPD affects 5.9% of adults, which is about 14 million Americans at some times in their life. BPD affects 50% more people than Alzheimer's disease and nearly as many as schizophrenia and bipolar combined. BPD affects 20% of patients admitted to psychiatric hospitals, and it affects 10% of people in outpatient mental health treatment. Some of the causes of borderline personality disorder show that research on the causes and risk factors for BPD is still in early stages. However, scientists generally agree that genetic and environmental influences are likely to be involved. Certain events during childhood may also play a role in the development of the disorder, such as those involving emotional, physical, and sexual abuse. Loss, neglect, and bullying may also contribute. The current theory is that some people are more likely to develop BPD due to their biology or genetics, and harmful childhood experiences can further increase the risk. The Prognosis shows that research has shown that outcomes can be quite good for people with BPD, particularly if they are engaged in treatment. With specialized therapy, most people with borderline personality disorder find their symptoms are reduced and their lives are improved. Although not all the symptoms may ease, there is often a major decrease in problem behaviors and suffering. Under stress, some symptoms may come back. When this happens, people with BPD should return to therapy and other kind of support. Many individuals with BPD experience a decrease in their impulsive behavior in their 40s. But what does the name borderline personality disorder mean? Historically, the term borderline has been the subject of much debate. BPD used to be considered on the borderline between psychosis and neurosis. The name stuck, even though it doesn't describe the condition very well, and in fact may be more harmful than helpful. The term borderline also has a history of misissue and prejudice. BPD is a clinical diagnosis, not a judgment. Current ideas about the condition focus on ongoing patterns of difficulty with self-regulation, which is the ability to soothe oneself in times of stress, and trouble with emotions, thinking, behaviors, relationships, and self-image. Some people refer to BPD as emotion dysregulation. Treatments for borderline personality disorder. Current research shows that treatment can decrease the symptoms and suffering of people with BPD. Talk therapy is usually the first choice of treatment, unlike some other illnesses which medication is often first. Generally, treatment involves 1 to 2 sessions a week with a mental health counselor. For therapy to be effective, people must feel comfortable with and trust their therapist. Some BPD symptoms are easier to treat than others. Fears that others might leave, intense, unstable relationships or feelings, or emptiness are often hardest to change. Research shows that treatment is more effective in decreasing anger, suicide attempts, and self-harm, as well as helping to improve overall functioning and social adjustment. People whose symptoms improve may still have issues related to co-occurring disorders such as depression, substance abuse, eating disorder, post-traumatic stress disorder, bipolar disorder type 2, etc. However, research suggests that full-blown BPD symptoms rarely come back after remission. But there are several treatments that are most often used to manage BPD. To be specific, there are 7. The first of all is dialectical behavior therapy, DBT, which focuses on the concept of mindfulness or paying attention to the present emotion. DBT teaches skills to control intense emotions, reduce self-destructive behavior, manage distress, and improve relationships. It seeks a balance between accepting and changing behaviors. This proactive problem-solving approach was designed specifically to treat BPD. Treatment includes individual therapy sessions, skills training in a group setting, and phone coaching as needed. DBT is the most studied treatment for BPD and the one who's shown most effective. Mentalization-based therapy, MBT, is a talk therapy that helps people identify and understand what others might be thinking and feeling. Number 3. Transfer-focused therapy, TFP, is designed to help patients understand their emotions and interpersonal problems through the relationships between the patient and the therapist. Patients then apply the insights they learn to other situations. Good psychiatric management, GPM, provides mental health professionals an easy-to-adopt toolbox for patients with severe personality disorders. Number 5. Medications cannot cure BPD, but can help treat other conditions that often accompany BPD, such as depression, impulsivity, and anxiety. Often patients are treated with several medications, but there is little evidence that this approach is necessarily or effective. People with BPD are encouraged to talk with their prescribing doctor about what to expect from other medication and its side effects. And number 6, self-care activities include regular exercise, good sleep habits, a nutrition diet, taking medication as prescribed, and healthy stress management. And last but not least, good self-care and help to reduce common symptoms of BPD such as mood changes, impulsive behavior, and irritability. If you know someone who has BPD, it affects you too. The first and most important thing you can do is help your friend or relative to get the right diagnosis and treatment. You may need to make an appointment and go with your friend or relative to see the doctor. Encourage him or her to stay in treatment or to seek different treatment if symptoms do not appear to improve with the current treatment.